Welcome to the Deep Dive. This is where we plunge right into a stack of your sources, sift through all the noise, and hopefully pull out the absolute gold nuggets of insight for you. Today, we're tackling something that, well, it touches almost everyone, especially as we, or maybe our loved ones, navigate the later stages of life. I'm talking about the annual doctor's visit.
Ah, yes, that familiar routine.
You know the drill, right? That seemingly endless list of recommended tests. And there's this pervasive belief, this idea that more prevention means longer life.
Hmm.
But what if, and this is what got me in these sources, what if some of these routine checks, particularly for women over 70, might actually be doing, more harm than good?
It's a really powerful paradox, isn't it?
Right.
And often quite unsettling. We're so deeply conditioned, I think, to believe that when it comes to health screenings, more is always better. That every test is just an unquestionable step towards a longer, healthier life.
Yeah, it feels almost irresponsible to question it sometimes.
Exactly. Yet, as the sources you've shared with us really vividly illustrate, there's this powerful, almost, well, one source called it a billion-dollar system at play. It's a system that's quietly pushing tests that, while they seem benign or even beneficial on the surface, can carry some pretty significant hidden risks.
Hidden risks like what, specifically?
Well, we're talking about things like cumulative radiation exposure from scan after scan, year after year, or triggering these cascades of false positives.
Which must cause so much anxiety.
Oh, tremendous anxiety.
Yeah.
And that leads to overdiagnosis, being told you have a condition that might never have actually harmed you. And then that pushes people towards unnecessary, sometimes dangerous treatments. It can become this really insidious part of what's just considered routine care.
And the data you mentioned, the data backing this up, it's pretty eye-opening, isn't it?
It really is. There was this shocking 2021 study, which I know we'll dig into a bit more.
Yeah.
It actually revealed that up to 42% of older adults received at least one unnecessary test that led directly to avoidable harm.
42%. Avoidable harm. That's nearly half.
Think about that. Almost half experienced direct harm from a medical procedure that wasn't even needed in the first place. That number alone, it really should give us pause, shouldn't it?
Absolutely. So, okay, our mission today for this deep dive is to really carefully navigate this complex, sometimes counterintuitive landscape of health screenings. We're focusing specifically on older women, and we'll be drawing from two distinct but equally crucial perspectives we found in your source materials.
Right. One perspective is going to highlight those tests that genuinely warrant some serious questions. We'll detail the potential harms, the pitfalls of overdiagnosis, and maybe some unexpected long-term consequences.
And the other side of the coin?
The other perspective will illuminate the truly vital screenings, the ones that absolutely remain essential for well-being, for maintaining quality of life in those later years. Because it's not about avoiding all tests.
No, definitely not. It's about knowing the difference.
Precisely. Our goal here, for you, the listener, is to offer a shortcut, really, to being truly well-informed on this critical subject. We want to arm you with some surprising facts, maybe some nuanced understandings and practical insights, things that will empower you to have much more informed, proactive, and ultimately more personalized conversations with your own healthcare providers.
Yeah, it's not about ditching your doctor or skipping necessary care at all.
Not at all. It's about transforming you, the listener, into an active, knowledgeable partner in your own health journey.
Being able to figure out when a routine test is genuinely helpful and when it might be worth, asking some deeper questions.
Exactly.
All right, let's dive in. Let's unpack this. We're going to start with what we're calling the cautionary tale. This first part is all about those times when routine tests, despite being so widely accepted, might actually cause more harm than help. And we're focusing on what one of our sources, Senior Secrets, carefully lays out as 5 tests to question.
Okay. And when we talk about overtesting, particularly for older women, it really goes beyond just being a bit inconvenient or, a waste of time and money. While the idea of more prevention sounds great on paper, I mean, who wouldn't want to catch something early? Some tests can inadvertently lead to significant, sometimes life-altering issues.
Like the things you mentioned before, radiation, false positives.
Yes, concerns like cumulative radiation exposure, which adds up over years, or that emotional roller coaster of false positives, which triggers anxiety, stress, and often more invasive, sometimes painful follow-up procedures. And this idea of overdiagnosis is especially insidious, I think.
Explain that a bit more. What does that really mean in practice?
It means being diagnosed with a condition that isn't actually dangerous, maybe it's very slow growing, or maybe something that would never have caused symptoms in your lifetime anyway. But once you have that label, You get pushed down a path of unnecessary treatments, and some of those treatments carry very real, significant risks.
So you're dealing with the side effects of treatment for something that wasn't going to hurt you.
Exactly. Imagine the psychological burden, believing you have a serious illness when you don't, and then add the physical toll of interventions you never actually needed.
And these harms, they're not just theoretical possibilities, are they? The sources get specific.
Oh, intensely real. The sources meticulously point to potential issues like um, chronic fatigue that just lingers for months,
Yeah.
persistent anxiety from being stuck in this state of medical uncertainty, even things like profound disruption of hormone crashes, or sometimes irreversible organ damage.
Wow.
We've seen mentions of tests potentially spiking stroke risk or leaving people grappling with lifelong infections, all initially presented under that comforting umbrella of preventive care.
And that statistic you mentioned keeps ringing in my ears, that 2021 study, up to 42% experiencing avoidable harm.
Avoidable harm from unnecessary tests. That figure, representing almost half of a whole demographic of older adults, it really should make every single one of us pause, ask serious questions, and just become much more discerning about what tests we agree to.
Okay, so where do we start? Which is the first test on this cautionary list?
Right, let's begin by putting a spotlight on the first test that truly warrants a closer look. Bone density scans, commonly known as DEGECA scans.
Okay, DECA stain scans. I think many older women, especially past 70, are very familiar with these. They seem to get ordered frequently at annual checkups. The stated purpose is detecting osteoporosis, right? Where bones get weak and brittle, more likely to fracture. It seems straightforward, responsible even.
It certainly sounds that way, and that's really part of the challenge here. But here's the crucial and often overlooked catch for seniors. By the time a woman reaches her 70s, her bones will naturally and predictably start showing some signs of density loss.
That's just normal aging.
It's an expected part of the normal aging process. Much like, getting wrinkles on your skin or your hair turning gray. It happens.
Mm-hmm.
The fundamental problem kicks in because these scans use a system called the T-score.
The T-score, right? What's the issue with that?
The issue is that this system compares an older woman's bone density not to other healthy women her age, which would seem logical, wouldn't it?
Yeah, that makes sense.
But instead, it compares her bones to the peak bone density of a healthy 30-year-old woman.
Wait, seriously, a 70-something woman's bones are being graded against a 30-year-old's peak?
Precisely.
That seems completely skewed.
Yeah.
It's like comparing, as you said, the skin of a 70-year-old to a 30-year-old and then calling every wrinkle a disease needing aggressive treatment.
You've hit the nail on the head. It's a fundamentally flawed comparison. And it often leads to these normal age-related changes being mislabeled as alarming. This results in a significant problem of overdiagnosis and then consequently overtreatment.
Is there data on how often this happens?
Yes, there's a compelling 2015 report. It was published in JAMA Internal Medicine. It revealed that over 0% of women over 70 who were diagnosed with osteopenia.
Which is like mild bone loss, right? Not
Yeah.
full osteoporosis.
Exactly. It's considered a milder form. Over 60% of them were subsequently prescribed strong medications. These are primarily drugs known as bisphosphonates. And these medications, they carry a whole list of serious side effects. We're talking about frightening conditions like jaw decay, atypical spontaneous fractures in other parts of the body, painful esophageal ulcers.
Oh my goodness.
And what's particularly, galling is that for most of these women, they were never actually at a real or significant risk of a fracture in the first place. Certainly not a risk that warranted such aggressive drugs.
So older women are being put on potentially dangerous drugs for a condition that wasn't really dangerous for them in terms of their actual fracture risk.
That's the net effect, yes. And another study, this one from 2018 in the journal Bone, it really solidified this point. It stated that women over 70 with no history of fractures and a T-score above man at 2.5, which is often the threshold used, had an incredibly low annual risk, less than 3%, of actually having a hip fracture.
Less than 3%. That's remarkably small for such an aggressive response with these drugs.
It truly is. This data strongly suggests that for the vast majority of these women, medication just isn't necessary, especially if they're already doing simple things like strength and balance exercises.
Right. The source mentioned a specific example, didn't it? Margaret.
Yes, Margaret's story is quite poignant. She was a vibrant 74-year-old, a retired librarian, avid gardener. She was prescribed one of these bisphosphonates after a routine DEXA scan showed osteopenia based on that T-score. Within just a few weeks, she started getting severe heartburn, increasing difficulty swallowing. It eventually landed her in the hospital with significant esophageal damage.
All from the medication.
All traced back to the medication. When her case was carefully reviewed, it became clear her original fracture risk was actually quite low. Her active lifestyle, daily walks, good diet, sunlight was already providing substantial natural protection. Once they stopped the unnecessary drug and treated her esophagus, she made a full recovery, felt stronger, healthier, without the burden of this dangerous, unneeded medication.
That really drives the point home, doesn't it? The real-world impact. So for our listeners, what are the safer alternatives or things to consider here? When should you maybe think about skipping the scan?
Well, if you're an older woman, say past 70, and you have no history of broken bones, it's often more prudent to actually skip the routine DEXA scan. Unless, of course, you've had a recent fall or your doctor notices actual clinical signs of fragility, like you're noticeably shrinking in height or there are significant posture changes.
Okay, so not just based on age alone.
Right. And when a more accurate, holistic assessment of your true fracture risk is genuinely needed, there are better tools, like something called FRAX. This tool incorporates multiple personal factors, not just bone density, but your age, weight, family history of fractures, other medical conditions, to give a much more individualized and frankly accurate prediction of your 10-year fracture risk.
That sounds much more comprehensive.
It is. And here's something surprisingly impactful from Osteoporosis International. Just engaging in gentle, consistent resistance training even 2 or 3 times a week with light weights or resistance bands has been shown to improve bone density by up to 6% in women over 70.
6% improvement just from gentle exercise.
Yes, no scan needed, just consistent movement, good nutrition, bit of time. It really highlights how powerful lifestyle changes can be, often much safer than jumping to medication based on a potentially misleading scan.
Incredible. Okay, let's move on to the next cautionary tale. Annual blood panels, specifically focusing on kidney function. These seem like the absolute definition of responsible preventive care. Almost everyone gets them done every year, almost without thinking.
They absolutely give that illusion of comprehensive safety, don't they? Most older women over 70 are routinely told, get your annual panels. These usually check a wide range of things: cholesterol, blood sugar, electrolytes, general liver, and kidney function. And while it looks like smart, proactive care on the surface, when it comes to assessing the health of aging kidneys, routine blood panels often miss the real danger, and sometimes they can even inadvertently set the stage for more harm.
How? That seems so counterintuitive. We're told these tests check kidney function.
The key lies in one of the most commonly used markers for kidney function: serum creatinine.
Creatinine, right.
Doctors traditionally use the level of this waste product in your blood to estimate how well your kidneys are filtering. Creatinine is a byproduct of muscle metabolism. It's produced when your muscles work. But here's the critical detail, the one that's often not clearly communicated. Creatinine levels are profoundly affected by muscle mass.
And older women tend to lose muscle mass.
Exactly. After age 70, women naturally and progressively experience muscle loss. It's called sarcopenia. So this means even if their actual kidney function is declining, the absolute amount of creatinine produced by their smaller muscle mass might stay low enough to appear normal on a standard blood test.
Wow, so an older woman could have kidneys that aren't working well, but because she has less muscle, her creatinine looks fine, giving her and her doctor this completely false sense of security. That's genuinely deceptive.
It is deceptive. And it means countless older women might be walking around with unrecognized stage 2 or even stage 3 kidney disease that's a moderate and severe reduction in function with absolutely no awareness of it.
Is there proof of this happening widely?
Yes, a groundbreaking 2022 study, this is the Clinical Journal of the American Society of Nephrology, confirmed this exact deceptive reality. It found that standard creatinine-based blood tests missed early kidney disease in over 35%, more than a third of women over 70.
Over 35% missed.
Yes. And the researchers emphatically stressed the urgent need to switch to a more accurate, more reliable marker called cystatin C.
Cystatin C, why is that one better?
Because it's not affected by age or muscle mass in the same way. It gives a much clearer picture of actual kidney filtration, regardless of how much muscle someone has.
Okay, so the danger isn't just missing the diagnosis. It's what happens next when the doctor thinks everything's fine based on that misleading creatinine level.
Precisely. When these standard creatinine-based panels give a misleadingly normal result, doctors might unknowingly prescribe medications that are actually toxic to already vulnerable kidneys. Things like certain NSAIDs, non-steroidal anti-inflammatory drugs for arthritis pain, or maybe specific types of blood pressure meds.
And that could push the kidneys over the edge.
It can, without warning, precipitate a rapid and severe decline in kidney function, potentially even leading towards kidney failure. We saw this exact scenario with Donna. A vibrant 76-year-old retired teacher, very active, walked 3 miles a day. She came in complaining of increasing fatigue and swollen ankles. Her regular blood panel, taken just 2 months before, had shown completely normal results across the board. Baffling.
But her symptoms suggested otherwise.
Exactly. So we specifically ran a cystatin C test. Her estimated GFR, that's the glomerular filtration rate, the gold standard measure of kidney filtering capacity, was revealed to be just 44.
And what does 44 mean?
That clearly indicated stage 3B kidney disease, moderate to severe, which perfectly explained her fatigue and swelling. This discovery led us to stop a common over-the-counter medication she'd been taking, which had been quietly straining her already compromised kidneys.
And did stopping it help?
Within 2 short months, her energy levels significantly improved, the swelling in her ankles dramatically reduced, and crucially, her kidney function stabilized. It didn't reverse, but it stopped getting worse.
Wow. Just by patching it with the right test and stopping the offending medication. So the better alternative here is clearly the cystatin C test.
It is strongly recommended. If you are over 70, especially if you're naturally thin, or you've noticed age-related muscle loss, or you're taking medications that can affect kidney function, make it a point to ask your doctor specifically for a cystatin C test. Ask for it alongside, or ideally even, instead of the standard creatinine check. It's just significantly more reliable for accurately assessing kidney function in older adults.
And the National Kidney Foundation recommends it now.
Yes, they've formally recommended it since 2021 for elderly patients. And another point about frequent unguided blood draws. They can create this unnecessary anxiety, this sort of medical merry-go-round.
How?
Well, minor abnormalities might pop up that don't actually mean anything clinically significant. Maybe a slightly elevated liver enzyme or a marginally low sodium level, things that fluctuate. But these trivial deviations can then trigger follow-up scans, more blood tests, maybe even unnecessary treatments, all creating stress and consuming time without any real health benefit.
Chasing numbers instead of focusing on how the person feels?
Exactly. Often older women with stable health benefit far more from truly symptom-guided care. That means medical attention based on how you actually feel, how well you function day to day, rather than just chasing after and reacting to every single number on a lab report.
That makes so much sense. Okay, now for something even more startling, according to the source material. Our third point of caution involves a scan that's often marketed as a critical lifesaver, yet it might quietly double your risk of memory loss after 70. We're talking about CT angiograms.
Yes, CT angiograms. These are often recommended as, comprehensive heart checkups. They involve injecting a strong iodine-based contrast dye into your bloodstream. This allows for detailed images of your heart's blood vessels so doctors can visualize and identify any blockages or narrowing. They're frequently used to rule out coronary artery disease, the condition that narrows blood vessels and significantly raises heart attack risk. Sounds very advanced, very high-tech. It is. However, when these tests are used too freely, maybe too routinely, in older women without very clear, compelling symptoms, this test can quietly, insidiously lead to significant long-term harm.
Okay, what are the hidden risks associated with this advanced diagnostic tool?
Well, firstly, there's the kidney aspect again, which we just touched upon. The procedure uses that strong contrast dye, and it has to be meticulously filtered out by your kidneys. As we discussed, aging kidneys are often more fragile, less efficient than they might appear based on standard tests. If they can't clear that dye properly or quickly enough, it can cause something called contrast-induced nephropathy, a specific type of acute kidney damage.
So kidney risk again, but you mentioned memory loss. Dementia risk.
Yes, and that's the bigger and arguably more insidious concern highlighted by our source, the brain. A significant 2021 study published in the journal Stroke found something quite alarming. It found that older adults who underwent multiple contrast scans, not just CT angiograms, but any contrast scan within a 5-year span, had nearly double the risk of developing vascular dementia compared to those who didn't have those scans.
Double the risk of vascular dementia from a heart scan. That's a really concerning statistic. How can a heart scan affect the brain so profoundly?
Well, the precise mechanisms are still being thoroughly researched. It's complex. But the leading theories suggest a couple of things. The high concentration and chemical properties of the contrast dye might transiently disrupt the delicate blood-brain barrier.
The barrier that protects the brain.
Exactly. It's a protective layer of cells that normally stops harmful substances getting from the bloodstream into the brain. This subtle disruption, especially if it happens repeatedly over time, or perhaps the direct effect of the dye on the tiny blood vessels within the brain, It might contribute to microinfarcts, tiny microscopic silent strokes, or even chronic inflammation in the brain's blood vessels.
And this damage builds up silently.
It builds quietly, initially imperceptible, but over time it can eventually manifest as vascular damage and cognitive decline. It might start as subtle forgetfulness or confusion, and later could progress into more serious forms of dementia. And crucially, most patients, and even their families, they likely never suspect that these routine scans could be a contributing factor down the line.
Do we have an example that illustrates this kind of quiet accumulation of harm?
Yes, consider the case of Teresa. She was a spirited 79-year-old patient who came to attention after her third CT angiogram in just 4 years. Her first scan was for some mild chest pressure she felt during exercise, which was later put down to just being a bit deconditioned after an inactive winter. Each time, the scan showed her coronary arteries were clear, no significant blockages.
So the scans were negative in terms of heart disease.
Correct. But several months after her last scan, her family started noticing really alarming changes: persistent memory lapses, uncharacteristic mood swings, increasing difficulty following conversations.
And they couldn't figure out why?
When her extensive medical history was meticulously reviewed, there were no other clear identifiable risk factors for this cognitive decline. No diabetes, no smoking history, no head trauma, nothing obvious. However, those repeated exposures to contrast dye from the CT angiograms. They stood out as a highly probable, yet previously unconsidered contributing factor.
So the scans themselves might have contributed to her cognitive decline.
It was identified as a likely factor. While supportive measures like cognitive rehab and adjusting blood pressure meds helped her regain some function, the quiet damage was undeniable and deeply concerning. It raises serious questions about the risk-benefit calculation for repeated scans.
So when are these CT angiograms truly needed? And what are the safer ways to check heart health?
Look, CT angiograms are appropriate and can absolutely be life-saving if an older woman is experiencing clear, acute signs of unstable angina.
Unstable angina meaning?
That means chest pain occurring even at rest, or sudden shortness of breath with minimal activity, or unexplained fainting spells. In those kinds of emergent situations, the immediate diagnostic benefit definitely outweighs the potential long-term risks.
But not for less severe symptoms.
Exactly. For stable patients with only mild, vague, or maybe intermittent symptoms, safer and equally effective alternatives often exist. A standard treadmill stress test with ECG monitoring, for instance, that can often reveal the same underlying heart risk without exposing the brain or kidneys to potentially harmful contrast dye or radiation.
Okay, that sounds much less invasive.
It is. Another excellent, much gentler option is something called a coronary calcium score. This is a low-dose CT scan, but crucially, it's performed without contrast dye. It measures the buildup of calcium in the coronary arteries, which is a strong predictor of future heart events.
So it assesses risk without the dye?
Precisely. It's exceptionally useful for assessing long-term heart risk while being much, much kinder to the body, especially the kidneys and brain.
But are women typically offered these alternatives?
Unfortunately, the truth is, many women aren't fully informed about these less invasive choices. They often simply trust the test their doctor orders without realizing it could quietly be affecting their brain years down the line. The healthcare system sometimes prioritizes fast answers, perhaps, but we as informed patients need to start questioning the potential long-term cost of some of these tests.
It really is becoming clear that this routine label can be quite misleading, carrying substantial hidden risks. Okay, let's shift our attention now. Our next point of caution. The source describes this one as possibly the most commonly overused test in older women. Still aggressively pushed in hospitals today, despite apparently overwhelming evidence linking it to massive overdiagnosis and profound anxiety. We're talking about routine pelvic exams.
Yes, this particular test genuinely surprises many people, especially given how ingrained it feels in standard women's healthcare for decades. Routine pelvic exams, which involve a manual check of the uterus, ovaries, the vaginal canal, they are still performed on millions of asymptomatic women over 70 every single year.
Asymptomatic meaning they have no symptoms at all.
Correct. This happens even when these women present with absolutely no specific symptoms, no complaints, and have no known elevated risk factors for gynecological cancers.
But isn't prevention absolutely key here? Especially for things like ovarian cancer, which is notoriously difficult to detect early. Wouldn't a routine check help?
One would logically assume so, wouldn't you?
No.
But the compelling evidence, particularly looking specifically at asymptomatic older women, simply does not support routine pelvic exams for screening purposes. There was a definitive recommendation back in 2017 from the U.S. Preventive Services Task Force. They concluded there is no solid evidence whatsoever that these routine pelvic exams in asymptomatic women actually reduce cancer deaths or significantly improve outcomes.
No evidence of benefit, but potential for harm.
Exactly. In fact, they can, and quite often do, cause real harm. Routine pelvic exams frequently lead to what we call false positives.
Meaning the exam finds something that looks abnormal but isn't actually dangerous.
Precisely. Findings that appear abnormal but are, in reality, perfectly benign and not dangerous. But these seemingly abnormal findings then trigger this stressful, often unnecessary chain reaction of further investigations, more ultrasounds, invasive biopsies, and in far too many cases, even major surgeries, all of which carry magnified risks for older women.
Magnified risks. Why are the risks higher for older women with these follow-up procedures?
They are, due to several physiological changes that happen with age. Older women often have age-related thinning of the vaginal tissues, which can make the examination itself more uncomfortable and increases the risk of minor injury or tearing. Furthermore, they generally face an increased risk of infection after any invasive procedures like biopsies or surgery. And their bodies typically have much slower healing times compared to younger individuals.
That makes sense. Is there data on how often these follow-ups happen unnecessarily?
There is. A telling study, published in the Archives of Internal Medicine, found that a staggering 63%, nearly two-thirds of women over 65 who underwent routine pelvic exams, ended up undergoing at least one follow-up test that ultimately revealed no significant underlying condition, no cancer, no serious problem.
63% had follow-ups for nothing.
For nothing dangerous, yes. And what's even more problematic, perhaps, is that many of these follow-up procedures uncover what doctors sometimes term incidentalomas.
Incidentalomas, what are those?
They're small, benign growths or cysts, things that would never have caused symptoms, would never progress to cancer, and certainly would never shorten that person's life. They're just there. But once they're discovered on a scan or during a procedure, they create immense anxiety and psychological distress for the patient. And many women then feel pressured to undergo aggressive interventions, like surgery, just in case, even when the best and safest medical option is simply careful, watchful monitoring.
So it's a classic example of finding something that really didn't need to be found in the first place.
Absolutely. It's a medical wild goose chase that causes a huge emotional and physical toll for something that turns out to be entirely harmless.
The source mentioned Eleanor's story here, didn't it?
Yes, Eleanor, a gracious 75-year-old former chef. She came to us after a routine pelvic exam detected a small ovarian cyst, completely asymptomatic. Her doctor immediately ordered an ultrasound, then a CT scan, and finally, despite her lack of any symptoms, strongly recommended surgery just in case it might be cancerous.
Understandably, she must have been terrified.
She was. Fearing the worst, she went through with the surgery. The mass, when they examined it pathologically after removal, turns out to be a perfectly harmless, simple, fluid-filled cyst, incredibly common after menopause. Benign. But Eleanor ended up spending 5 days in the hospital due to surgical complications, and then required a full 6 weeks to recover at home from a major surgery that, in hindsight, never needed to happen.
And the emotional impact.
Profound. She confided in us later that she felt like she'd been living with a ticking time bomb inside her, only to discover there was never any genuine danger at all. The stress was immense.
So if routine exams are often unhelpful and potentially harmful for asymptomatic older women, when is a pelvic exam actually needed?
Okay, so for an older woman, a pelvic exam remains a really important diagnostic tool if she presents with specific concerning symptoms, such as new or worsening pelvic pain, any abnormal vaginal bleeding, especially any bleeding after menopause, which always warrants investigation, or persistent feelings of pressure or fullness in the pelvic area. In these symptomatic cases, the exam is crucial. It helps with diagnosis and guides the appropriate treatment plan.
But not for women who feel fine.
Exactly. For women who feel perfectly well, have no complaints, especially those who might have already had a hysterectomy years ago or completed their cervical cancer screenings decades ago. The routine annual exam offers virtually no proven benefit. And as we've seen with Eleanor, it can cause far more stress and harm than clarity.
So the approach should be symptom-guided.
A truly symptom-guided strategy is superior. Exams and scans should only be performed when there's a genuine clinical reason to suspect an issue based on how the patient feels or presents. And if imaging is needed because of symptoms, often a transvaginal ultrasound can offer detailed images with significantly less discomfort and risk than jumping straight to more invasive things. And while it's not perfect as a screening tool itself, newer blood tests like CA-125 can sometimes help in evaluating risk for specific symptoms without immediately resorting to invasive procedures.
Okay, that clarifies things significantly. Now that brings us to our final cautionary tale in this section. The source describes this one as perhaps the most aggressively promoted test of them all, yet one that may quietly harm memory, disrupt gut health, and even significantly raise your risk of sepsis, with virtually no one warning seniors about these profound hidden dangers. We're talking about colonoscopies past 70.
Yes, the colonoscopy. It's undeniably often described as the gold standard for colon cancer screening. It's widely recommended, heavily marketed, feels like a routine rite of passage once you hit your 50s. But the stark reality, according to this source, is that by the time you reach 70, especially if you've had prior clear screenings and you are asymptomatic, this test may quietly begin doing more harm than good, particularly in terms of quality of life and unexpected serious complications.
Wow, that's a striking reversal from the usual message. How can such a widely praised, seemingly life-saving test become potentially harmful in this specific age group, women over 70?
Well, a colonoscopy, as you know, involves inserting a long, flexible tube with a camera into the entire length of the colon. The goal is to visually inspect for and remove polyps, those small growths that can sometimes develop into cancer over time. Now, to perform this procedure safely and effectively, the colon has to be completely emptied out beforehand.
Ah, the dreaded prep.
Exactly. The PrEP. This is achieved using an extremely powerful laxative solution. And this is precisely where the complex cascade of issues really begins to unravel, particularly in older adults. The PrEP solution is profoundly dehydrating. It flushes the entire digestive system, removing not just waste material, but also vital electrolytes like potassium and sodium. And, critically, it also flushes out the beneficial bacteria that maintain a healthy gut microbiome.
And that's harder on older bodies.
Much harder. In older women, whose hydration reserves are often naturally lower anyway, and whose bodies are generally less resilient to electrolyte imbalances, this rapid, aggressive flush can lead to dangerous drops in blood pressure, significant strain on the kidneys, and severe electrolyte disruptions.
I can imagine how utterly debilitating, even dangerous, that must feel, especially for someone who might already be a bit frail.
It really is. A concerning 2016 study, this is in the American Journal of Gastroenterology, found that nearly 28% of patients over 70 experienced moderate to severe dehydration just from the colonoscopy prep.
Almost a third.
Yes, leading to debilitating fatigue, dangerous dizziness, and in some cases even requiring hospitalization before the procedure could even happen. But the deeper and often more insidious danger comes in the aftermath, in the gut itself.
The microbiome disruption you mentioned.
Exactly. The colon is home to trillions of diverse bacteria. Together they form the gut microbiome. It's a crucial ecosystem supporting your immune health, hormone balance, nutrient absorption, even contributing to brain function. After a colonoscopy, especially if polyps are removed or biopsies are taken, which create small wounds, this delicate microbiome can be severely disrupted for weeks, sometimes even months.
And what does that disruption do?
It weakens the gut barrier. Think of it as the specialized lining of the intestines that acts like a gatekeeper, normally preventing harmful bacteria and toxins from leaking out of the gut and into the bloodstream. If this barrier is compromised by the prep and the procedure, it dramatically opens the door to sepsis.
Sepsis, a life-threatening infection from a colonoscopy.
Yes, sepsis is a life-threatening body-wide infection that can rapidly lead to organ failure and death. And unfortunately, it's a very real risk associated with colonoscopy, especially in older, more vulnerable individuals.
That's incredibly serious. I imagine most people undergoing a routine screening are completely unaware of that risk.
I think you're right, most are unaware. A sobering 2019 report from BMJ Open found that older adults had a staggering 12-fold increased risk of sepsis hospitalization in the 10 days following a colonoscopy with biopsy compared to the general population.
12 times the risk.
12 times. And many of these severe sepsis cases occurred in people who had absolutely no prior symptoms. They were undergoing the test purely as a preventive measure, leading to devastating and potentially entirely avoidable outcomes.
That's terrifying. And there's another risk too, isn't there? The anesthesia.
Yes. Then there's the significant issue of anesthesia or sedation. Most colonoscopies require some level of sedation to keep the patient comfortable and still during the procedure. However, for adults over 70, particularly those who might have any pre-existing cognitive vulnerabilities. Even seemingly light sedation has been demonstrably linked to an increased risk of short-term delirium confusion right after the procedure, and more alarmingly, potential long-term memory decline.
Long-term decline, really?
Yes, a concerning study from Anesthesia and Analgesia in 2020 showed that 41%, 4 in 10 seniors, experienced measurable cognitive changes after outpatient anesthesia, like that used for colonoscopy. And crucially, these changes persisted for at least 1 month. For some, perhaps longer.
41% had measurable cognitive changes for a month or more. This really puts Joan's story, the 81-year-old piano teacher mentioned in the source, into stark perspective.
Yes, her story is a powerful, tragic illustration of these combined risks. Joan, who had a sharp mind, loved crosswords, intricate family stories. She had a perfectly clean colonoscopy when she was 72. No problems found. But her new doctor, apparently driven by a sort of blanket prevention guideline, pushed hard for another one at 81, just to be safe.
Despite her previous clear result.
Despite the previous clear result, the intense PrEP solution left her profoundly weak and dizzy. 2 days after the procedure, she developed a high fever, became confused, disoriented. She was rushed to the hospital, diagnosed with sepsis, spent 4 terrifying days in intensive care.
Did she recover physically?
Physically, she recovered enough to be discharged, but her daughter told the source she was never quite the same after that. Her once sharp memory noticeably slipped. Her vibrant appetite declined. She struggled with daily tasks she used to manage with ease.
And the colonoscopy itself, did it find anything?
That was the cruelest part. The colonoscopy found nothing dangerous or cancerous. It was an entirely unneeded procedure, based on her history, that profoundly and negatively altered her remaining years.
Such a sad story. So, putting it all together, dehydration, sepsis risk, cognitive impact, when is a colonoscopy truly needed for an older adult, say over 70? And what are the safer alternatives for screening in this age group if routine colonoscopy is questionable?
Okay, so let's be clear. If a woman over 70 has never been screened for colon cancer before, a first-time colonoscopy can still be very valuable. Or if she has new or concerning symptoms, things like persistent rectal bleeding, unexplained iron deficiency anemia, chronic unexplained digestive pain, then yes, the colonoscopy can still be a truly life-saving diagnostic and therapeutic tool. They can remove polyps right then and there.
So, for first-time screening or specific symptoms, it's still important.
In those specific scenarios, the benefits generally outweigh the considerable risks we've discussed. However, and this is the key point, who have had negative results from prior screenings, who are in otherwise reasonably good health, and whose life expectancy is estimated to be under about 10 years. Major medical guidelines, including those from the U.S. Preventive Services Task Force, actually recommend stopping routine colonoscopy screenings.
Stopping them? What's the alternative then? Just do nothing?
No, not necessarily do nothing. Safer, much less invasive options are readily available and highly effective for ongoing screening in appropriate older adults. These primarily include non-invasive stool tests, things like the FIT test, that's FIT, fecal immunochemical test.
How does that work?
It detects tiny amounts of hidden blood in the stool, which can be an early sign of polyps or cancer. It's easily done at home, just a small stool sample mailed to a lab, usually done annually. These tests, which are recommended for seniors who still meet the criteria for regular screening, have shown a high detection rate for colon cancer and significant precancerous polyps.
And crucially, without the risks of sedation, aggressive PrEP, gut disruption, or potential complications like sepsis or bleeding from polyp removal.
Exactly. It offers a high degree of protection without exposing the individual to the significant potential harms of the colonoscopy procedure itself, especially when done repeatedly in later years without clear indication.
That's a really crucial and, I think, very illuminating distinction. It absolutely underscores this idea that not all routine tests are created equal, particularly as we age and our bodies, our resilience, change. But now, let's gracefully switch gears, because we need to move to the second, equally important part of our deep dive today. While caution and discernment are absolutely key with some tests, as we've just discussed, prevention is still incredibly important. There are things we absolutely should be doing. Our other source, Joy Manning, meticulously highlights what she calls essential health screenings, what every older adult should consider.
Yes, and it's absolutely vital to re-emphasize this point. Preventive screenings do remain essential, particularly later in life. And in some cases, they arguably become even more critical. The CDC, the Centers for Disease Control and Prevention, notes that older adults are inherently at a greater risk for developing conditions that often progress slowly, sneakily, and critically, don't cause noticeable symptoms until they're quite advanced.
Things that creep up on you.
Exactly. We're talking about conditions like high blood pressure, diabetes, even certain cancers that can silently take hold without you feeling anything initially. And while, yes, it can sometimes feel like a hassle, another appointment, another test to fit into the calendar, and the CDC actually reports that fewer than half of adults over 65 are truly up to date on their standard health checks.
Fewer than half. That's surprising.
It is. But these proactive, often very simple, closer looks allow your doctor to catch and treat many of these insidious health issues before they become a big deal, before they severely impact your quality of life or become much, much harder to manage effectively.
That's a really important pivot. Okay, let's run through the 8 recommended medical screenings that, according to this source, every older adult should really get, starting with number 1, skin cancer screenings.
Right. A basic skin cancer screening is incredibly straightforward, completely non-invasive. It's usually a dermatologist or another qualified healthcare provider who simply inspects your entire skin surface. They're looking for any suspicious spots, moles, or lesions, but the potential benefit is immense. Early detection is absolutely paramount for melanoma, which is the most dangerous form of skin cancer. Tragically, it still kills over 10,000 people a year in the U.S.
But it's curable if caught early.
When caught early, before it has a chance to spread deeper or to other parts of the body, melanoma is almost always curable. So the Skin Cancer Foundation vigorously encourages all adults, especially as they age and naturally accumulate more sun exposure over their lifetime, to see a dermatologist at least once a year for a full-body professional skin check.
And more often if you're higher risk.
Yes, more frequent checks are definitely recommended if you're at increased risk. That includes people with fair skin that burns easily, anyone with a significant history of sunburns or tanning bed use, or if you have close family members who have had melanoma. It's such an easy, quick check that can be genuinely life-saving.
Okay. Number 2 on the essential list, blood pressure. This one often gets called the silent killer, and I imagine its importance only grows with age.
And for very good reason. High blood pressure or hypertension truly earns that nickname. According to the American Heart Association, the AHA, almost half of all adults in the U.S. have elevated blood pressure.
Half.
Almost half. Yet a staggering number of them remain completely unaware of their condition. Why? Because typically there are no obvious symptoms in the early or even moderate stages. It's identified as the primary or a contributing cause of death for nearly 500,000 Americans every single year.
500,000 deaths related to high blood pressure.
Yes, and your age itself is a significant risk factor. As we get older, our blood vessels gradually lose some of their elasticity. They tend to stiffen up over time, which naturally increases pressure. Fortunately, checking blood pressure is perhaps the most simple, non-invasive, and routine part of basically any annual wellness visit or doctor's appointment.
Yeah, they do it every time.
Exactly. It's a fundamental measurement. It provides immediate insight into a major cardiovascular risk factor. And catching it early allows for timely intervention, often started with lifestyle changes like diet and exercise, or sometimes medication before serious damage occurs to the heart, brain, kidneys, or eyes.
Okay, up next, number 3, cholesterol levels. Again, something with no obvious symptoms, so screening seems crucial.
Precisely. Just like blood pressure, your cholesterol numbers are an incredibly important measure of your risk of developing heart disease, including heart attacks and strokes. It's measured with a simple blood draw, usually done after a period of fasting, maybe 9 to 12 hours. The test reveals your total cholesterol, but also breaks it down into your HDL, that's the good cholesterol, your LDL, the bad cholesterol, and your triglycerides, which are another type of fat in the blood.
And since you don't feel high cholesterol.
Right, since high cholesterol has no discernible symptoms, screening is the only way to know where you stand. This essential information then empowers you and your doctor to make informed decisions. Maybe it's lifestyle choices, dietary adjustments, increasing physical activity, or maybe it indicates the need for cholesterol-lowering medications to get those numbers into a healthier range. Either way, knowing your numbers significantly helps reduce your overall cardiovascular risk.
Makes sense. Number 4 is about fasting blood sugar levels, specifically screening for diabetes.
Yes. The American Diabetes Association generally recommends this blood test at least once every 3 years for most adults, although frequency might increase based on risk factors. It's ideally performed in the morning after an overnight fast. Now, a critical reason to undergo this screening, especially as we age, is to detect prediabetes.
Prediabetes, where blood sugar is high but not yet high enough for a diabetes diagnosis.
Exactly. And the CDC reports a truly alarming statistic here. 1 in 3 American adults currently has prediabetes. 1 in 3.
Wow.
And here's the kicker. A staggering 84% of those people with prediabetes are completely unaware they have it, simply because they haven't been screened.
84% don't know. That's huge.
It's huge. Detecting prediabetes early provides this crucial window of opportunity. It gives you the chance to take proactive, often simple preventative steps, primarily through diet modifications, and increased exercise to actually prevent the progression to full-blown type 2 diabetes.
So you can stop it before it starts?
In many cases, yes, or at least significantly delay it. Type 2 diabetes is a chronic condition with really wide-ranging health complications affecting nerves, eyes, kidneys, heart. So preventing it is incredibly valuable. If you're at high risk due to factors like obesity, family history of diabetes, or maybe a history of gestational diabetes during pregnancy, your doctor might recommend screening even more frequently, perhaps twice a year.
Good to know. Then we have number 5, dental exams. We often think of dental health as kind of separate from overall health, but the source stresses a direct and significant link, particularly to heart health. Is that right?
That's absolutely right, and the American Heart Association emphasizes this connection too. While the exact biological mechanisms aren't fully mapped out yet, robust research clearly links chronic gum disease periodontitis to a significantly higher risk of developing heart disease.
Gum disease linked to heart disease. How common is gum disease in older adults?
Very common. The CDC reports that more than 2/3, over 66% of adults aged 65 or older, are currently living with some form of gum disease.
More than 2/3.
Yes. So regular dental cleanings and comprehensive checkups, combined with diligent daily brushing and flossing at home, are paramount. Not just for maintaining good oral hygiene, but also for helping to keep both your mouth and your heart healthier. Plus, dental exams serve to catch smaller problems like cavities or early signs of oral cancers before they escalate into much bigger, more painful, and often more expensive issues like severe infections or even tooth loss. Your dentist can sometimes spot clues about systemic health just by looking in your mouth.
Okay, important connection there. Number 6, eye exams. The source says even if you think you have perfect 20/20 vision, these are still vital. Why is that?
Correct. These easy routine checkups are essential, not just for ensuring you have optimal vision, identifying the need for eyeglasses, or maybe updating your prescription, but for much more than that. The American Academy of Ophthalmology strongly notes that even individuals with seemingly perfect vision need regular comprehensive eye exams. Why? Because they can spot more serious, often completely asymptomatic eye health issues in their earliest, most treatable stages.
Like what kind of issue?
Things like glaucoma, which damages the optic nerve, often silently at first, or age-related macular degeneration, AMD, which affects central vision. Both of these are leading causes of irreversible vision loss in older adults, if not caught and managed early.
So they catch eye diseases early. Anything else?
Yes. Moreover, a skilled optometrist or ophthalmologist can actually detect subtle changes in the tiny blood vessels at the back of your eyes, in the retina. These changes can often be crucial early warning signs of systemic conditions like high blood pressure or diabetes, sometimes long before you experience any other symptoms elsewhere in your body. It's like a little window into your overall vascular health.
Fascinating. Okay, next up, number 7, hearing exams. It feels like hearing loss is just an expected part of getting older, but the source implies we shouldn't just dismiss it.
It is incredibly common, you're right about that. And tragically, it's often dismissed as just normal aging. In the U.S., roughly 1/3 of people between 65 and 74, and almost half of those 75 or older, struggle with some degree of age-related hearing loss.
Half of those over 75.
Almost half. Now, beyond the obvious impacts like conversational awkwardness, difficulty understanding speech, maybe leading to social isolation, hearing loss has significant and often really underestimated health consequences.
Such as?
Well, one immediate danger is missing important warning sounds, maybe a smoke detector, a car horn, an ambulance siren. That's a safety issue. But crucially, recent and really compelling research has found strong ties between untreated hearing loss and a faster rate of cognitive decline.
Hearing loss linked to dementia risk.
Yes. A landmark study from Johns Hopkins University followed people over 10 years. It noted that even mild hearing loss doubled the risk of developing dementia during that time. Moderate loss tripled the risk. Severe loss increased it fivefold.
Doubled the risk with just mild hearing loss. That's significant.
It's very significant. The thinking is that the brain has to work much harder to decode sounds when hearing is impaired, potentially diverting cognitive resources from other tasks like memory. Also, social isolation linked to hearing loss is a known dementia risk factor. So, getting your hearing checked regularly isn't just about hearing better. It can signal the need for interventions, like a hearing aid. And using hearing aids significantly improves communication, reduces that cognitive load, fights isolation, and markedly enhances overall quality of life and potentially brain health.
Okay, really important point there. And finally, number 8 on this essential list, colon cancer screenings. Now, wait a minute. This one sounds very familiar because we just spent a good chunk of time hearing about the potential dangers and reasons to question colonoscopies, especially past 70. How do we reconcile this apparent contradiction? It feels like whiplash.
Right. And this is a truly crucial nuance to understand. It perfectly highlights why personalized care, based on individual circumstances, is so much more important than just following blanket guidelines without thought. The American Cancer Society accurately describes colon cancer as a very preventable, very treatable disease when it's detected early. For individuals who are in good general health and typically younger than about 76, regular screenings, whether stool tests or visual exams like colonoscopy, can absolutely be life-saving. They effectively catch and allow for the removal of precancerous polyps before they ever have the chance to develop into full-blown cancer. This source, Manning's perspective, is emphasizing the general importance of screening for colon cancer overall and correctly points out that screenings come in several different forms.
So the seeming contradiction isn't really a contradiction. It's about context, about the specifics of the person and the type of screening, maybe.
Exactly. It really lies in the context and the specific individual's health profile and history, rather than an outright disagreement about the fundamental value of screening itself. Our earlier discussion, the cautionary one, meticulously highlighted the very specific risks associated with colonoscopy. The procedure itself, particularly for asymptomatic women past 70, especially those who have a documented history of prior clear screenings and maybe a limited life expectancy due to other health issues.
Right. For that specific group, the risks of the procedure might outweigh the screening benefit.
Correct. For that particular demographic, the risks we discussed, severe dehydration, sepsis risk, potential cognitive impact from sedation, can sometimes outweigh the marginal benefit of finding a small polyp via routine colonoscopy, particularly when equally effective. Much less invasive alternatives like the FIT stool test exist for ongoing screening. This source, conversely, is stressing the undeniable importance of colon cancer screening in general for older adults who are still appropriate candidates for it, based on age, health status, and screening history.
So the personalized approach is absolutely key here.
Paramount. It boils down to asking, are you over 70 and asymptomatic with prior clear screenings and maybe significant other health issues? Then perhaps an annual non-invasive stool test, like FIT, is your safest and most effective ongoing screening option after discussion with your doctor. Or have you never been screened before, regardless of age? Or do you have new concerning symptoms like persistent rectal bleeding or unexplained anemia? Then a colonoscopy, despite the risks which need to be managed, could indeed be diagnostic and potentially life-saving.
It's all about that detailed, thoughtful conversation with your healthcare provider about your specific situation, your individual risk factors, your health history, and frankly, your personal preferences regarding invasiveness versus frequency of testing.
Precisely. No blanket answers.
Okay, that makes perfect sense now. It clarifies the distinctions beautifully. Now, beyond those 8 widely recommended screenings, our source also highlights 6, maybe lesser known, but equally important, health checks that you should definitely proactively ask your doctor about. The first one is a simple but potentially powerful check-in on your lifestyle.
Yes, just a quick, honest, open conversation with your doctor about your daily habits. Things like your alcohol consumption, any tobacco use, current or past, your typical eating patterns, your physical activity levels. It might seem basic, but this conversation could be a remarkably powerful catalyst for positive behavior changes, even small ones. Your provider isn't there to judge you. They're there to support your health goals.
And they can offer resources.
Absolutely. They can recommend valuable resources, maybe connect you with smoking cessation programs if needed, refer you for nutritional counseling, or provide tailored guidance on how to incorporate healthier eating habits or more movement into your daily routine safely. It's a good reminder that it's truly never too late for lifestyle upgrades, And even small, sustainable changes can yield significant health benefits as we age.
Good point. Next up, something maybe not often discussed openly, but the source says it's critically important, especially if you're sexually active later in life. STDs or sexually transmitted diseases.
Yes, this is important. Cases of sexual transmitted diseases, including HIV, chlamydia, gonorrhea, syphilis, have actually seen a notable increase among adults over 65 in recent years, according to data from the CDC.
Really? An increase in that age group?
Yes, this is particularly relevant for individuals who might be re-entering the dating scene after, say, decades of being in a monogamous marriage, perhaps due to divorce or widowhood. They may not be as accustomed to discussing or consistently taking precautions against STDs. There can sometimes be a societal discomfort, maybe for both doctors and patients, in discussing sexual health openly in older adults, which can unfortunately lead to underscreening.
So people shouldn't assume it's not relevant just because of age.
Absolutely not. So it's incredibly important for you, the listener, to take the initiative if this applies to you. Directly ask your doctor if STD screenings are appropriate for your specific situation and lifestyle. It's about your health and safety, plain and simple, regardless of your age.
Okay, very important message. Number 3 on this list of checks to ask about. Fall risk. This is obviously a massive concern for older adults, often leading to serious injuries, loss of independence.
It truly is a huge concern, and rightly so. Every single year, a staggering 3 million older adults end up in the emergency room or hospitalized because of a fall, according to the CDC.
3 million hospitalizations a year from falls.
Yes, leading to things like hip fractures, other broken bones, serious head injuries, and often triggering this downward spiral of reduced mobility, fear of falling again, and loss of independence. The good news is that fall risk can be assessed and often reduced. Your healthcare provider can assess your individual risk by asking a few simple, targeted questions about your balance, any history of falls, your medications, and maybe even your home environment.
And they can identify specific risks.
Yes, they might identify, for instance, a specific medication you're taking that's known to cause dizziness or drowsiness, and perhaps it could be safely swapped for an alternative with fewer side effects. Or they might recommend checking your vitamin D level, as deficiency is a known factor that weakens muscles and bones, making falls more likely. They might prescribe a vitamin D supplement if needed.
And things we can do ourselves.
Absolutely.
Yeah.
You can actively reduce your own risk significantly by incorporating specific strength and balancing exercises into your routine. Things like Tai Chi are excellent. And diligently doing a safety check of your home environment, removing tripping hazards like loose rugs, improving lighting, installing grab bars in the bathroom. It's an area where proactive prevention can have a truly life-altering impact.
Definitely worth the effort. Then we have a hepatitis C. The source flags this as a silent threat for a specific demographic group. Who needs to ask about this?
If you were born between the years 1945 and 1965, part of the baby boomer generation, you fall into the age group with the highest historical incidence of hepatitis C infection in the U.S. Robust screening for this virus is highly recommended for everyone in this birth cohort at least once.
Why is it called a silent threat?
Because hepatitis C is often called a silent killer. The virus attacks the liver and can lead to serious long-term liver problems, including cirrhosis, scarring of the liver, and even liver cancer. But the insidious part is that it often remains completely asymptomatic, causing no noticeable symptoms for decades, while the damage is slowly occurring. The CDC estimates that roughly half of those who actually have chronic hepatitis C are completely unaware they are infected.
Half don't know they have it.
Roughly half. Screening, which is just a simple blood test, is the only definitive way to catch it. And catching it early is crucial because there are now highly effective antiviral treatments available that can actually cure the hepatitis C infection in most people, usually within 8 to 12 weeks, and prevent the progression to severe liver disease.
So screening leads to a cure for many. That's fantastic. Okay, next, and crucially, depression screening. Mental health is just as, if not more, important than physical health as we age.
Absolutely. Your mental health is truly a foundational aspect of your overall sense of well-being. It impacts your cognitive function, your energy levels, your ability to engage with life joyfully, your physical health. Everything is interconnected. If you've been dealing with persistent feelings of sadness, maybe a noticeable loss of interest or pleasure in activities you normally enjoy, or significant changes in sleep or appetite, and these feelings have lasted for 2 weeks or more, it's imperative that you talk to your provider and ask for a depression screening.
And it's treatable even later in life.
Very much so. Depression is a highly treatable condition, even in later life. There are various effective therapies available, including counseling, medication, lifestyle changes, social support. But the absolutely crucial first step is accurate identification through screening and diagnosis. Please don't suffer in silence. Help is available.
Great advice. Finally, number 6 on this list of checks to ask about: nutrition. Our relationship with food definitely changes over a lifetime, and the source says it's particularly important to monitor as we age.
Yes, as you age, changes in weight are incredibly common. But significant changes in either direction, substantial unexplained weight loss or significant weight gain, can be problematic indicators. They might signal underlying health issues or perhaps nutritional shortfalls or imbalances.
So changes in appetite or weight should be discussed.
Definitely. A thorough nutrition evaluation by your doctor can help reveal any dietary imbalances, specific nutrient deficiencies, or perhaps underlying health associations that are progressive. They can help you get on track with an eating plan that better meets your body's evolving needs as you age. This might involve a referral to a registered dietitian for a personalized guidance on meal planning and food choices. Or, importantly, if economic factors like cost or access are impacting your ability to get healthy food, your doctor or their team can often connect you with a social worker or community resources to help address those crucial barriers to good nutrition.
That's really helpful. Okay, let's try to pull all this together now. Let's unpack this whole deep dive. We've meticulously explored some really powerful arguments for caution with certain seemingly routine medical tests for older women. We've detailed the very real potential for harm, the pitfalls of overdiagnosis, the burden of unnecessary procedures. And then we've also delved into equally powerful arguments for the fundamental importance of other screenings that truly are vital for maintaining health and quality of life as we age.
Right, the essential checks.
So it feels like we've heard two strong, but maybe slightly different messages. What does this all mean for us, for you, the listener, trying to navigate this?
You know, what's truly fascinating here, when you look closely, is that these sources aren't actually conflicting in their core message at all. Rather, together, they illuminate a profound, overarching truth: the absolute critical importance of personalized care as we navigate the complexities of aging.
Personalized care, moving beyond the standard checklist.
Exactly. It's about moving decisively beyond a simplistic, one-size-fits-all routine approach to healthcare, an approach often driven more by age brackets than individual needs, and instead embracing a much more nuanced, much more individualized understanding of our unique health needs, our specific risks, and importantly, our personal values and priorities.
So for you, the listener, what does that translate into? What's the key takeaway?
I think it translates into a crucial shift in mindset and approach.
A shift from what to what, precisely? Give us the bottom line.
Okay, fundamentally, it's a shift away from blindly accepting blanket screening protocols, which are often driven primarily by age alone, and moving towards a much more deliberate, symptom-guided, and risk-informed approach for many of these tests we discussed in the first half. The greatest benefit, and importantly the least harm, often comes when tests are genuinely guided by specific symptoms you're actually experiencing or by identifiable individual risk factors that apply to you, rather than simply being performed because another year has passed on the calendar.
And remembering that every test has a potential downside.
Absolutely. Remember, every single medical intervention, every test, every medication, every procedure carries some degree of risk. It might be small, but it's rarely zero. For older adults, particularly those over 70 or 75, that delicate balance of risk versus benefit can shift quite dramatically compared to when they were younger. Their bodies might be less resilient, the potential gain from finding something small might be less if life expectancy is shorter, and the potential harm from the test or subsequent treatment might be greater. So it's about actively, thoughtfully considering this intricate balance for every test that's proposed, and really understanding that what was clearly beneficial for you at age 50 might not hold the same positive balance at age 80.
So it really comes down to empowerment through information then, doesn't it? It sounds like the goal isn't to suddenly avoid doctors or distrust all medical advice,
Not at all.
but rather to become a highly informed, proactive advocate for your own health within the healthcare system.
Exactly. That's the perfect way to put it. The ultimate goal here is to empower you, the listener, to actively engage in your own care, to feel confident asking discerning questions, to openly discuss alternatives, risks, benefits, and your comprehensive personal health profile, including your lifestyle and values in detail with your doctors.
And we saw how some of the alternatives fit this model.
Yes, we can clearly see how some of the safer alternatives presented earlier, like using the cystatin C test for a more accurate picture of kidney function, or opting for the non-invasive FIT stool tests for ongoing colon cancer screening. When appropriate, they actually align perfectly with this spirit. It's about effective, yet less invasive, and ultimately more personalized screening. It's about choosing smarter, not necessarily just choosing more.
Ultimately, then, it all really boils down to the quality, the depth of that doctor-patient conversation, doesn't it? It sounds like it needs to be a true collaboration.
It absolutely does. Shared decision-making, that's the term often used. It's where medical expertise from the doctor meets the individual wisdom, experience, and values of the patient. It has to be based on your specific health status right now, your personal values, what quality of life means to you, your priorities for your health and your future, and yes, realistically, your life expectancy. All of that needs to be part of the conversation.
So it's not about second-guessing your doctor in some kind of adversarial way.
No, definitely not. It's about partnering with them, engaging in a rich, honest, two-way dialogue to collectively make the best, most informed, and most appropriate choices for your unique health journey, ensuring that the care you receive is truly tailored to you, not just blindly following a set of generalized age-based guidelines.
Wow, what an incredible, truly eye-opening deep dive we've been on today. It feels like we've covered a lot of ground. We've explored health screenings that, while certainly well-intentioned, require a really cautious, questioning approach due to their potential harms, especially for older women. The DEXA scans, the routine blood panels for kidneys, CT angiograms, routine pelvic exams, later life colonoscopies.
The cautionary list.
And then we also delved into those absolutely essential screenings that remain undeniably vital for health and well-being as we age: skin checks, blood pressure, cholesterol, blood sugar, dental, eyes, hearing, and yes, appropriate colon cancer screening. Providing that balanced, comprehensive view, it really does reshape your entire perspective on what preventative care truly means in later life, doesn't it? It's
Yeah.
not as simple as more is better.
It profoundly does. It shifts the focus from quantity of tests to the quality and appropriateness of care. If there's one powerful thought to maybe leave you with today, distilled from the collective wisdom of these sources we've explored, it's perhaps this. The most powerful medicine isn't always a high-tech machine or the latest test. Sometimes it's personalized care based on your actual symptoms, your individual risks, and deep, honest conversations with doctors who genuinely understand the unique complexities and priorities of aging.
That's beautifully put. So the final question really is for you, the listener. What does all of this mean for you? How does this deep dive reshape your view of preventative care and perhaps your relationship with your own healthcare journey moving forward? What's maybe one health decision, one test, one conversation you're now inspired to question more deeply or research further or discuss more openly with your own doctor now that you're armed with this new knowledge and perspective? We sincerely hope this deep dive empowers you to have those crucial conversations and to take an even more informed, active role in your own health and well-being. Thank you so much for joining us on the Deep Dive.